Welcome to the COPD Foundation podcast. We bring you insights from leading health professionals, inspiring stories from those living with lung conditions, practical advice, and the latest in lung health research. Be sure to subscribe, follow us on social media, and visit copdfoundation.org. Take action today, breathe better tomorrow. Just a quick note before we jump into our topic. This podcast series was created for educational purposes only and is not a substitute for formal medical advice. Talk to your healthcare provider if you have any questions.
Hello, and welcome to the COPD Foundation podcast. I'm Amanda Atkinson, an RN and an educator at the COPD Foundation. I'm your host for this episode, and I'm joined today by one of my favorite guests, Dr. Sandy Sandhouse.
Sure. Hi, I'm Dr. Sandy Sandhouse. I'm a pulmonologist based in Denver, Colorado at National Jewish Health. And I'm also the medical director of the Alpha One Foundation and AlphaNet, two not-for-profits that support patients in the Alpha One community.
We're also joined today by two brilliant people from our patient community.
My name is Dan. I'm a ZZ Alpha 1 patient from Buffalo, New York.
Hello, everyone. My name is Diana. I am a long-term alpha. I was diagnosed many years ago.
The four of us got together today to discuss some of the most common questions that we receive from our patient community about living well with COPD. So let's jump right in. Most of us know that old saying, you are what you eat. We know that proper nutrition is a huge part of being and staying healthy, and we get a ton of questions from patients asking for nutritional tips or strategies. Diana, are there any dietary strategies that you found most helpful in managing your condition?
As I said, I've been a long-term alpha, and I have found over the years that a decrease in activity just absolutely increases weight over time. There's no getting around that. So my biggest problem is that I've gotten less active, is to try to eat less and eat more healthy foods. I try to avoid things like carbohydrates, salt, processed foods, and processed foods mainly because they have a lot of carbohydrates and they have a lot of salt generally. Another reason I try to avoid carbohydrates is things like bloating. You ever gone to a Mexican restaurant, eating a whole tray full of chips and come out feeling like you can't breathe? I try to eat less carbohydrates, more. I eat more in the mornings too, and less at night. I feel like I sleep a whole lot better if I eat less at night. I don't feel so full, and so I don't feel so much pressure on my lungs.
Well, carbohydrates for the given amount of calories that you use generate a lot of CO2, and the main mechanisms for getting rid of CO2, which acidifies your blood, if it's in higher concentration, is through the lungs, through exhaling CO2 through the lungs. So it does put a little extra strain on the lung. In addition, alpha 1 patients have an additional factor to consider with carbohydrates, is that alphas are susceptible to liver disease as well as lung disease. And the liver disease often starts out as a fatty liver. And we've learned over the decades now that fatty liver isn't due to eating too much fat. It's generally due to eating too much carbohydrates, and then the liver storing those calories as fat in the liver for the times of famine. Unfortunately, that fat in the liver can irritate and inflame the liver and worsen the risk of liver disease. There's no special diet, really, that is magical in COPD. I know everyone has their favorites, and the best diet is the one that works for you to achieve the weight and energy goals you're trying to get to.
You are so right, Dr. Sandhouse. I can't tell you how many different diets I have tried and failed. The key really is finding what works best for you, finding a diet that you'll stick to, and that takes trying things out. So, Diana, you mentioned movement and exercise. We're asked a lot of questions about both of those things. What types of physical activity do you incorporate into your daily routine? And how does movement help you with your overall well-being and symptoms?
Okay, sure. I can talk about my exercise routine a little bit. The most important point, I think, is to really find something that you really like to do. Because if you don't like to do it, at least a little bit, you're probably not going to do it. I've always been a really active person over my lifetime. Things change as you get older, and I've had to give up a lot. Like I used to ride horses a lot every weekend, and a lot of things I like to do, all day shopping things. But I've tried to keep up with what I still like to do. And one of the things I do 3 days a week is I go to water aerobics. I find like, okay, Monday, I think this week, I got up in the morning and I thought, just don't feel like going. And, walking, difficult. But I made myself go. I walked into the building. I got in the water, and I can do what they can do in the water. Something to do with the support, I guess. Your body's supported, your chest is supported, and I can do 2 hours of water aerobics. Makes me feel better, it makes me sleep better. So I stick with that, and I also think that pulmonary rehab is really important. I keep an exercise bike at the house, nothing fancy, just a small one. If I can't go somewhere, if I can't get out and do something, then I will I'll ride my bicycle, because I'm just really basically moving my legs. I make myself get up about every 2 hours and just walk. If I'm walking, I've got an area in my house. I can make a circle, and I'll walk that circle for so many laps, and I'll sit back down. Of course, if it's bad, I'll take oxygen with me. But I feel like you got to keep moving.
Thank you, Diana. Dr. Sandhouse, are there any particular exercises or movements, including pulmonary rehab, that you might suggest for your patients? And additionally, what are some signs that patients could look for that they might need to modify their current exercise or movement routine?
So, among the major things you want to do with any exercise program is you're trying to avoid the spiral of shortness of breath. Therefore, I'm doing less exercise. Therefore, I'm in worse shape. Therefore, I'm more short of breath. Therefore, I do even less exercise. You want to reverse that downhill spiral into a rising spiral by exercising, and making sure that all the muscle groups are being exercised, appropriately. The advantages of pulmonary rehab are that it's not just that there are machines there that you can use. It's that you've got supervision, you've got monitoring of your oximetry during exercise to make sure that your saturations and your oxygen levels aren't dropping too low. So you get an idea of how much you should push yourself without becoming dangerously short of breath or having dangerously low oxygen. Plus, there's a whole educational process to help you understand your disease that's part of pulmonary rehab. Pulmonary rehab has been demonstrated over and over again to improve the lives of people with COPD. But unfortunately, there's also a dwindling number of available pulmonary rehab centers, and sometimes getting the pulmonary rehab covered can be difficult. And there's a limit to how many sessions a lot of the insurers, including Medicare, will permit you. But it's well worth it. There's a growing number of home-based pulmonary rehab programs that are available that do things like use the equipment that you have in your home, whether it's a chair or an exercise ball, that have people doing weights by holding soup cans and going through some upper extremity exercises in that way, or taping them to your ankles. So there's a variety of ways to improve exercise tolerance and break that cycle of shortness of breath and loss of muscular activity and tone and things like that. And the important thing to remember is that when you're exercising, it's not because you want to exercise enough to become Arnold Schwarzenegger in his heyday. It's because a successful exercise program is one where you say, "Oh, I walked further today than I've worked in a while, and I had less shortness of breath." So it's a subtle change. It doesn't give you a lot of positive feedback in the beginning until you look back and see how much you've accomplished with your exercise program.
We know that many people are curious about pulmonary rehab, but some are hesitant because they're not quite sure exactly how the program works. Diana and Dan, can you share with us any experiences that you've had with pulmonary rehab, or maybe some advice for somebody who's wondering about the process?
I think they should talk to their doctor about it, and I think that most would recommend it, and most insurances will pay for it. Um, how it helps is you're going at your own pace. They might tell you to, they've got, they want to strengthen your arms. So you have those arm machines that you do this, you're working on your arms, and other machines. You walk the bike, but they set you at a really, really slow pace to start. And as you improve, they might pick up that speed a little bit. And the same with the arms, the muscles. They can modify it just for you, give you a lot of education, and it's just a good experience.
I did pulmonary rehab for the first time last year after I had COVID. I was having some residual issues, getting back to where I wanted to be as far as my respiration went. And so I discussed it with my doctor, and most pulmonologists are receptive to people doing it, and sometimes it might take a month or two to get into a rehab facility. But almost everyone I ever talked to showed positive results from being involved with that. And really what it does is it shows you how you can exercise even at home, because they'll coach you after you finish the pulmonary rehab. They'll coach you on how to do it at home and continue on with that. And hopefully it will become a lifestyle change where you exercise more and you're doing exercises that are geared towards your breathing. So that's it's always been a positive experience for everybody that I've talked to, and it certainly helped. And they also discuss breathing techniques and things like that because they're respiration therapists that are administering these types of things.
Dr. Sandhouse, Dan mentioned that he was having trouble getting back to where he wanted to be after an illness. One major concern that many patients express is not knowing how hard to push or how much to do during or after an exacerbation. Can you give us some best practices for navigating that situation?
Well, one of the things that we've learned in the last several years is that we used to recommend that when people, for instance, had an exacerbation, that they hold off on their exercise program until they've fully recovered from the exacerbation, which can take weeks. Nowadays, we encourage people to continue their exercise program even during an exacerbation or a flare of their lung disease or some other illness that they're having. Just modify the exercise so that you cut back to what you can do. If you have a home oximeter or something like that, or if you're using oxygen, you may have to adjust the amount of oxygen during some kind of a flare or exacerbation. Um, but it's really important to get started back in your exercise program, even at a low level, very early in the course of a lung infection or a pneumonia or an exacerbation.
Exacerbations often come with at least temporary changes in medication. One of the most common challenges that we hear about is managing medication regimens. Do you have any tips to help people who might be struggling to manage that aspect of their treatment?
Mhm. Yeah, that's a great question. Um, I think that there's been over the decades dramatic improvements in the duration of action of a lot of the medications that we take, especially inhalers. Um, you know, 20 years ago, there it was being on an inhaler or a nebulizer every 4 to 6 hours, 24 hours a day, sometimes letting up during sleep. Nowadays, with so many inhalers allowing you to take the drugs every 12 or 24 hours, it adds a lot of convenience to take it, but it also means that if you miss a dose, you've missed an entire day of coverage for your lung disease. Um, and there's growing evidence that taking inhalers appropriately and taking the right combination of inhalers can improve survival and lifespan, and also, of course, help you to function during the day and at night. Um, the other things, of course, are temporary drugs that you might take during a flare or an infection, including antibiotics, steroids, things like that. You need to understand those medications when you're taking them and not miss a dose. So it's become easier to do your medications appropriately and well, but it also means that missing a medication can have a greater impact on your day or your night when you're taking long-acting medications and might miss some. It's also important to have your immunizations up to date so that you can try to prevent things that would cause exacerbations. Um, and it's been really wonderful to watch as these new medications move forward.
Yes, making sure that you understand and are using your medications correctly is vital. Whenever you receive a new prescription, it's important to ask your doctor or pharmacist about that medication. And remember, you can ask for a demonstration of how to properly use your inhalers. And then make sure that when you're taking your medication, that you set aside time to do that. Don't rush through the process because you really want to ensure that you're taking the correct medication in the right manner.
A large portion of people that use inhalers use them incorrectly and or not enough. I was guilty of that the first couple of years. I would only use it if I was feeling ill. Proper inhaler use is something that I do religiously now, but it was something I always talk to other alphas about, is making sure you use your inhalers properly. And to, doctors, your pulmonologist will go over that with you every visit if you want them to.
Sometimes when we talk about living well with a chronic condition, we only think about the things that we've already discussed on this podcast, like medication or nutrition and exercise. And those are very important components, but we don't want to overlook another vital component, which is diagnostic testing. So we know that currently there's a really big gap of time between symptom onset and diagnosis of COPD and alpha 1 and even bronchiectasis, which can lead to further lung damage and decrease in quality of life. So Dr. Sandhouse, can you address this important topic for us, please?
We've talked about alpha 1 as a very rare disease, but in fact, in COPD in general, about 1 out of every 100 COPD patients has undetected alpha 1 antitrypsin deficiency, and finding that one person out of 100 entirely changes their treatment and the course of their disease. That's why current guidelines recommend that every patient with COPD be tested for alpha 1. Testing can be a simple blood test, a swab of the cheek, like on CSI, or a finger stick. It's easy. There's even free testing available and home testing available for alpha 1. And finding it not only explains why someone has lung disease and changes their treatment, it also identifies a family that's at risk of having this abnormal gene running through the family, since it's all hereditary. In the diagnostic delay, the time from symptom start to the time that bronchiectasis or alpha-1 antitrypsin deficiency is identified usually means that by the time it is identified, it's worse than if it had been identified in an early phase when treatment could delay the progression of disease or halt the progression of disease. So what I'd recommend, first of all, is to follow guidelines, and current guidelines for management of COPD and current alpha 1 guidelines say that every COPD patient should be tested with a simple blood test or cheek swab for alpha 1 antitrypsin deficiency. It's a one-time test. It's looking at your genes, and so your genes don't change in general. And so if you have a negative test when you're 20 years old, you never have to have it again. And if you have a positive test when you're 20 years old that shows you do have alpha 1, then you can be monitored much more carefully and started on specific treatment that replaces the missing protein at the earliest possible time.
Ever since I was diagnosed, and I was young, and I believe it saved my life, and I believe it can save many other lives. And so I don't go into a doctor's office, especially a new one, without asking them what they know about alpha 1. I don't go into any kind of, you might be getting blood drawn, and you'll ask them what they know about alpha 1. You might be talking to just anybody out and about that's willing to talk to you, because it's so important. And testing, I tell people about testing all the time. You run into someone at church that's just having some lung problems. Or, for instance, one of my very best friends I used to ride horses with, never smoked in her life, doesn't even drink, nothing. And all of a sudden she's having lung problems. I used to go get tested. And finally got her to do the home test, and she was an MZ. Of course, now she's all gung-ho, let's get my family tested, and all her family's getting tested. And one of her family members, I believe, was either SC or ZZ, but much more severely deficient. So you're not only helping yourself, you're helping a lot more people, and they're helping a lot more people, and they'll be talking about it. So that's very important.
Dan and Diana, Dr. Sandhouse mentioned specific treatment for alpha-1, augmentation therapy, that's indicated for some patients and is administered through an IV infusion. Can you talk to us a little bit about the planning and the management of that treatment?
Sure, I can talk a little bit about my medication usage. And yes, I use augmentation therapy and a number of other meds. And it's the most important thing I could tell anybody is take your medicine. If you're not doing it, it's not doing you any good. To me, augmentation therapy is the most important. I pick one day a week. I stick with that day. For instance, I always do it on Wednesdays. I don't go to the gym on Wednesdays. When I used to work, I retired in 2019. I guess, I can't believe it's been 5 years, but my routine was always Wednesday. We had a conference call every day at 1:00. I'd be sitting on my infusion. Nobody knew, I just plug it in and go. So that I think is the most important. And another thing is I try to keep some of my medications close, and I know you can't do that if you've got children, but I don't have kids or grandkids close, and I take one medicine for AFib, and it has to be twice a day at the same time every day. So I keep it beside my chair, my recliner, because I know in the morning I'm eating breakfast and I'm going to be sitting there. I'm going to take that pill. And 12 hours later, I'll be watching TV in that recliner, and I'll take my pill. I just, you've got to be in a routine, or you can really mess up.
Thank you, Diana. Diane, do you have any insights that you'd like to share?
I get it every week. And at first it seemed like it would be very intrusive. I was still working at the time. But there's a lot, if you get your infusions at home, your home healthcare nurse can work with you. And even infusion centers or hospitals will usually have after work hours. So they try to be as accommodating as possible for things like that. People that travel, there's different ways you can handle that. If you're going to be traveling for an extended period of time, you can make arrangements to get infusion centers where you're traveling to administer your augmentation therapy. It takes some coordination with the specialty pharmacies, but that is something that's possible, and people do that, especially snowbirds that go to Florida or Arizona or something for the winter. They'll make arrangements 2 or 3 months before they leave and coordinate everything as far as deliveries and infusion centers go, or nursing, and they're able to make a transition fairly smoothly.
In our final few minutes of this episode, Dr. Sandhouse, in your years of practice, what have you seen make the most significant impact on improving the quality of daily living for your COPD and alpha-1 patients?
I think education is the most important thing. Knowing what the disease is, what causes it, what you can expect to happen, both in the short term and long term, with current technology, what new technologies might be coming in the future, so that there's something to look forward to, and perhaps even participate in a clinical trial to test some of those new therapies or technologies. I think there's a growing use of things like remote monitoring and wearables and things along those lines that are going to change how we monitor ourselves and how medical personnel monitor patients over the coming years, and it's going to be happening fairly quickly. And I think it's getting on the right regimen in terms of medication and exercise and social support as quickly as possible, so that you can live the longest and highest quality life with your chronic condition.
Thank you, Dan, Diana, and Dr. Sandhouse for joining us today and for sharing these great tips for living well with COPD and alpha-1. If you enjoyed this discussion, be on the lookout for more episodes as we dive into things like advocacy, intimacy in COPD, social and family support, and much more. You've been listening to the COPD Foundation podcast. For more information about COPD, Alpha-1, and other chronic lung conditions, visit the COPD Foundation at copdfoundation.org and our other social media channels. And to connect with other individuals living with COPD, join us on our social network located on our website, COPD 360 Social.
Thank you for tuning into the COPD Foundation podcast, and remember, whether you're managing a chronic lung condition, providing support to those who are, or just want to learn more about lung health, the COPD Foundation is here to support you. Be sure to subscribe to this podcast and follow us on social media. Take action today, breathe better tomorrow.